My name is Dr. Richard Hilsden, and you're watching Knife Skills. Today I want to talk to you about what to expect when you're having gallbladder surgery. Now, if you're not a patient of mine, some of these things may not apply to you, and I strongly encourage you to speak to your own surgeon when it comes to what to expect for gallbladder surgery. If you're one of my patients, I want to say thank you. It's a great opportunity for us to work together, and truly it is something that we do together. I am your surgeon, but I'm only one member of the team. Yourself, the nurses, the anesthesiologists will all be working our hardest to make sure you have a good experience. I wanted to create this video because there's sometimes it's difficult to discuss all the things in the short period of time we have for a consultation. And patients will oftentimes have questions, maybe they're afraid to ask, and hopefully this can answer it. So let's start off with the day of surgery. So after you've gone through your pre-admission and you've been cleared to have the operation, we expect you to show up at the hospital about 2 hours before surgery. The night before, we're going to ask you not to eat after midnight. We have relaxed the rules a little bit. It will allow us to have clear fluids up to 2 hours before the operation. And what that really means is nothing more than black coffee. You can have a fruit juice that doesn't contain any pulp or anything within it, just essentially carbohydrates and water. And please don't have anything to eat that you would chew. Even one bite can actually put your surgery at risk. After you've come to the hospital, you'll go through the day surgery process, which includes an interview by the nurses, confirmation of the surgery that's going to happen, IVs will be started, antibiotics may or may not be given, and then you're brought to the operating room. In the operating room, we perform a checklist, making sure everything is ready to go, and then you're off to sleep. Under anesthetic, you shouldn't have any awareness, and that's our expectation. And then you'll emerge from anesthesia in the recovery room. Now, a couple things. It's really important that you bring someone with you on the day of surgery. This person will give you a ride home. And also, we really recommend that you actually have someone stay with you in your home for the day of surgery and overnight, just so they can check on you and you're not completely alone. And that's very important. Now, when I perform gallbladder surgery, I do it laparoscopically, and that essentially means 3 incisions. And that essentially means 4 incisions. 1 in the belly button, 1 in the upper part of the abdomen, and 2 on the right side. Now, in my hands, truly 1 out of 50 patients who undergo laparoscopic surgery have a conversion to open, especially when we're talking about elective surgery. And what that means is instead of me being able to complete the operation using the small instruments, we actually have to make a larger incision to go and actually remove the gallbladder. Unless there's a very unusual anatomy, you can expect at the end of the procedure, whether we did it laparoscopically or open, to have your gallbladder removed. That's our plan when we go into it. Now, again, we're talking mostly about laparoscopic surgery here, so this is what to expect. You'll go home the same day of surgery, as we mentioned, making sure you have that ride and the person with you. In addition, we'll have dressings on your abdomen, and those will have little pads to absorb any blood, and you'll see some staining, and that's normal. Those dressings are recommended to stay on for 2 days. Then our recommendation would be to peel them off, and you don't actually need to put any other dressings on top of it. You can just allow them to be exposed to air. Underneath the dressings, we put stereo strips. They're special tapes that will help reinforce our incision, and those will come off in 1 week. Usually they'll fall off on their own, but if they haven't, we recommend that you get in the shower, just let some water run over it, and the tapes will come off. After that, the skin has been actually sewn with an absorbable suture underneath the skin, which you're not going to have removed. Now, from a recovery point of view, most people are feeling pretty good 4 or 5 days after surgery, but we really recommend avoiding any heavy lifting for 3 weeks after surgery. And ideally, I'd rather see you in my clinic, which I usually see about 1 month after, to make sure you're ready and to go back to work or whatever your other activities can be. Certainly, some people work in a self-employed environment and cannot take that much time off. We can have a negotiation really as far as what would be best for when you should return to work. In addition to that, my recommendation is that if you do go back to work early, just avoid lifting more than 20 pounds. Now, when I do give you clearance to go back to work in your regular activities, my advice for you at that point is to gradually get back up to your full exercise potential. You've taken some time off, you're not as fully conditioned. And so it's really important that you take a minute, let yourself build that strength back up before you're back to your full activities. On the final follow-up appointment, we'll discuss two things. We'll see how you did, how you felt after surgery, and make sure you're doing okay. And we'll review the pathology, making sure that what we found in the gallbladder was really just gallstones or what we expected when we went into the operation. Lastly, it's important to understand how much pain you should expect after having gallbladder surgery. And really, it's going to be sore because it is surgery, but you shouldn't expect too much pain. In fact, more than 80% of our patients only require Tylenol or Advil over the counter to recover from their gallbladder surgery. So we may prescribe additional medications that would be available to you, but recognize that Tylenol and Advil really is all that's required. And although there will be some discomfort, we expect that, it does get better over the first few days. And again, most people can manage with those simple strategies. Finally, my staff is always available. We're happy to return your calls. If you have any concerns, please give our office a call and we'll address it. Again, if I'm your surgeon, I just want to say thank you, and it's a great opportunity for us to work together. And if I'm not your surgeon, please bring some of these questions and concerns to your own surgeon, as everybody's experience is going to be different. You've been watching Knife Skills, and my name is Dr. Richter Hilsden. Thank you for joining in.